Doctors of Reddit, what is something that you wish everyone knew about their body? This one is more about medication. Antibiotics only work against bacteria. They are not some kind of wonder potion that cures anything, and they should not always be given. Please stick to your prescription the doctor gives you. Even if you already feel better, don't just stop unless the doctor says you can stop. A lot of medication needs to be taken according to the prescription in order for it to be effective, because you build up the doses to an effective level. Stopping or not sticking to it really decreases effectivity. Ejaculating blood happens to most people at least once in their lives, and in 99% of cases it resolves without taking any action within a week. It doesn't even warrant a doctor visit. Peeing blood, for both sexes, is a serious medical emergency and you should immediately go to the ER. People think it's the other way around. Tell us what drugs and alcohol you're on. We aren't gonna tell the cops. We aren't gonna lecture you. But it might change the anesthesia I give you. Some stuff I give you might kill you. If you drink a 30 pack a day, tell me. If you could keep track of the assorted parts you've had removed or added, that'd be very helpful. I'm not saying you need to know whether your fundoplication was in a son or a door, but if you're complaining about belly pain it would be nice to know that the last time you had belly pain they took out your gallbladder/appendix/sigmoid colon. And if you've ever had something implanted and they gave you a little card, that's not warranty information. That tells us if you're going to explode. If you go in an MRI, bring it. Otherwise it will be googled. How to eat healthy. Just because you're skinny doesn't mean you're healthy. Especially the teenagers who I take care of. Sometimes I will ask them what's a healthy food your doctor wants you to eat. Rarely do I get a right answer. I feel like the internet has so many fad diets, and family members rarely cook, so families don't know basic nutrition facts. My phone is acting up, so if this has already been posted I apologize. But women, please do not use soap or douching products inside your vagina. It has a delicate pH balance and this is how you get yeast infections. Wash your labia, but do not clean internally. The vagina is self-cleaning just like your eyeballs. Do you wash your eyeballs? No. Do you wash your face? Yes. Don't do DIY surgery or hold off on reporting things that are obvious warning signs. Don't be the guy who tried to remove his skin cancer with a knife. You need some kind of exercise. Doesn't matter how you feel right now. Sitting for 12 to 16 hours a day will have negative consequences. Your kidneys and liver cheerfully do all the toxin elimination you'll ever need. Cleanses and other detoxifying products are bullshit woo and a waste of money. The people who sell them are predators who only care about your money becoming thieves. Type 2 diabetes is more serious than most people realize. I work as a doctor in hemodialysis and most of them are due to diabetic nephropathy. It also affects your eyes, nerves, immune system, etc. Simple life changes can help you, but no one seems to care. I even lost 9 kilograms myself because I had a family history of diabetes and to be healthy. Edit. Wow, thanks for the silver stranger. I didn't expect this comment to be big, but please take care of yourselves people, because it is really sad for us doctors to see people get ill because of a preventable illness. Also there are lots of good subreddits for people trying to make a lifestyle change. You and your body deserve better. Edit 2. Change diabetes to type 2 diabetes for clarification. Changed easy to simple. How to check for skin cancer. If you see any moles or anything that are A. Asymmetrical. B. Odd borders, like they are jagged or something. C. Color, different colors. D. Diameter, grows. E. Evolve, well, evolves. Go get it checked out. It might be skin cancer. That administering CPR compressions as soon as possible is one of the greatest indicators of successful outcomes. Where the orifice each gender urinates through really is. Antibiotics are not some magic cure for every pain in your body, nor for the flu or common cold. Never ever boil breast milk. In my country there is a popular belief that breast milk jaundice in newborns can be treated by boiling one's breast milk, but by doing this, you destroy all the nutrients and it basically becomes as nutritious as water is. Do not give honey to children below the age of 1. Do not rub your child with rubbing alcohol as to lower his furor. Baby wipes don't substitute daily baths/showers. Yes, I'm a pediatrician. I'm a vet, but I'm sure some doctors will have come across this too. Amputated limbs do not grow back. I've had far too many people asking how long it will take for their pet's amputated limb to grow back, so I'm assuming a few doctors out there will have had patients asking the same of their own missing limbs. You often will feel normal even with high blood pressure. It's often found incidentally. So don't wait until it gives you symptoms you don't want to go through. Edit. To all those wondering how to figure out if it's asymptomatic, get checked at least once a year. If you're over 35, why? There's no other way. Edit 2. Thank you for the silver and gold kind strangers. There is no cure. Your mental health is just as important as your physical health. You only get one body. The way you treat it has a significantly higher impact on how your health will end up in a decade than what sort of interventions we can give you. You really should treat your body like a temple. Edit. It's a saying now. If you want, treat it like a family heirloom, bonsai, or your favorite china. Edit 2. The original question is asking what I wished more people knew about their body. I answered this by saying I wish they would do more, to do more self-care. Advice that is easier said than done. This means keeping up with mental and physical health, eating well, exercising, and not utilizing tobacco/nicotine, drinking to an excess, or other substances. I'm in no way advocating for avoiding the use of prescribed medicines or advice given to you by your own primary care provider. I'm a dentist, and if you don't take care of your gums your teeth will fall out of your head, and you'll get pissed at me when your jawbone atrophies and your denture doesn't fit anymore. Edit. Essentially periodontitis causes inflammation and recession of the gums, which in turn cause inflammation and recession of bone. After that, teeth start getting mobile and falling out. Edit 2. I appreciate you all asking questions and trying to improve your oral health, but without doing an exam and x-rays there's very little I can actually recommend other than using one of those new patient coupons you get from every dentist in the neighborhood to get checked out. Also I love the /dentists. Baby doctor here, about to graduate. Unless you have liver or kidney failure, your body detoxes itself really well. Don't get scammed by these detox teas and whatever. Edit. I mean that I'm a baby cause I'm just starting out. Not that I'm a doctor of babies, just to be clear. I won't specialize for a while yet. My mom tells her teen patients' parents Alet that the acne isn't the teen's fault, but runs in the genes sometimes when it's bad. That they only have one and their behavior now, drinking, smoking, not taking medicines, or whatever, will impact their life quality and expectancy. Sounds logical, but very few patients really realize it. Injuries accumulate. I cannot stress this enough. Little kids have no business lifting heavy weights or getting pushed so hard in sports by some of these coaches who seem to have little knowledge of physiology or don't care about the long-term impact of the regimens. Stuff like this really changes people's lives.